Hello and welcome. Today we're diving into a critical topic concerning eye health: vitamin A deficiency-related conjunctival changes. This condition, stemming from a lack of vitamin A, can have serious consequences for vision, particularly in children. Let's explore the intricacies of this deficiency and its impact on the eyes. The primary cause, as the name suggests, is a deficiency in vitamin A. This can arise due to several factors. Firstly, inadequate dietary intake of vitamin A-rich foods, such as liver, eggs, and leafy green vegetables, is a major contributor, especially in developing countries where access to these foods is limited. Secondly, malabsorption issues can prevent the body from properly absorbing vitamin A, even if it's present in the diet. Conditions like celiac disease, cystic fibrosis, and certain intestinal disorders can hinder absorption. Finally, certain medical conditions or infectious diseases can increase the body's demand for vitamin A, potentially leading to a deficiency if intake isn't sufficient. Vitamin A is crucial for maintaining healthy epithelial tissues, including the conjunctiva, the clear membrane that covers the white part of the eye and the inner surface of the eyelids. When vitamin A levels are low, the conjunctival cells undergo squamous metaplasia. This means they transform from their normal, healthy state into flattened, keratinized cells, similar to skin cells. This disrupts the normal mucus production, leading to dryness and a compromised protective barrier. These cellular changes make the conjunctiva more susceptible to infection and damage, ultimately resulting in the characteristic signs and symptoms of vitamin A deficiency-related conjunctival changes. Vitamin A deficiency is a significant public health concern, particularly in developing countries. It's estimated that millions of children worldwide are affected, with Southeast Asia and Africa being the most vulnerable regions. Populations relying heavily on rice-based diets, lacking in vitamin A, are at higher risk. Factors such as poverty, food insecurity, and limited access to healthcare contribute to the widespread prevalence of this deficiency. It also disproportionately affects children under the age of 5 and pregnant women, who have increased vitamin A requirements. The signs and symptoms can vary in severity depending on the degree of deficiency. Early signs include night blindness or nyctalopia, where vision is impaired in low light conditions. As the deficiency progresses, the conjunctiva becomes dry and thickened, a condition known as xerosis. White spots, characteristic foamy, triangular-shaped plaques, often silvery white, may appear on the conjunctiva. These spots are accumulations of keratin and cellular debris. In severe cases, keratomalacia or corneal melting can occur, leading to irreversible blindness. Other symptoms may include photophobia, or sensitivity to light, and increased susceptibility to conjunctival infections. Diagnosis typically involves a comprehensive eye examination by an ophthalmologist or healthcare professional. This includes assessing the conjunctiva for dryness, white spots, and other signs of vitamin A deficiency. A detailed dietary history is crucial to evaluate vitamin A intake. Blood tests can be performed to measure serum retinol levels, which indicate vitamin A status. However, it's important to note that serum retinol levels may not always accurately reflect vitamin A stores in the body, especially in early stages of deficiency. Conjunctival impression cytology, a technique that examines conjunctival cells under a microscope, can also be used to identify squamous metaplasia. While specific classifications aren't typically used for conjunctival changes alone, vitamin A deficiency itself is often classified based on severity, ranging from mild to severe. These classifications are based on clinical signs and symptoms, as well as biochemical markers like serum retinol levels. However, when assessing the impact on the eye, the severity of conjunctival involvement, from simple xerosis to the presence of white spots and potential corneal involvement, provides a framework for understanding the progression and guiding treatment strategies. Treatment focuses on replenishing vitamin A stores and addressing any underlying causes of the deficiency. Oral vitamin A supplementation is the primary treatment method. High-dose vitamin A is typically administered, followed by maintenance doses. The specific dosage and duration of treatment will depend on the severity of the deficiency and the individual's age and overall health. Topical lubricants, such as artificial tears, can help relieve dryness and discomfort. In cases of secondary infection, topical antibiotics may be necessary. Addressing any underlying malabsorption issues is also crucial to prevent recurrence of the deficiency. A balanced diet rich in vitamin A, containing foods, is strongly recommended. Prevention is key, especially in at-risk populations. Promoting dietary diversity and encouraging the consumption of vitamin A-rich foods are essential strategies. Food fortification, where vitamin A is added to staple foods like rice or oil, can also be effective. Vitamin A supplementation programs, particularly for children and pregnant women, are widely implemented in many countries with high prevalence of vitamin A deficiency. Public health education campaigns play a vital role in raising awareness about the importance of vitamin A and the signs and symptoms of deficiency. The prognosis for vitamin A deficiency-related conjunctival changes depends on the severity of the deficiency and the promptness of treatment. Early diagnosis and treatment with vitamin A supplementation can often reverse the conjunctival changes and prevent further complications. However, in cases of severe deficiency with corneal involvement, such as keratomalacia, the damage may be irreversible, leading to permanent vision loss. Recent research focuses on improving vitamin A delivery methods, particularly in resource-limited settings. Studies are also exploring the role of genetic factors in vitamin A metabolism and susceptibility to deficiency. Advances in diagnostic techniques are aiming to develop more accurate and reliable methods for assessing vitamin A status.